everyone, and welcome to today's PHO Rounds on the BC Radon Repository and BC Radon Map, integrating disparate data sources for improved public health communication. My name is Elena McIntyre. I'm the Manager of Toxicology and Exposure Assessment at Public Health Ontario, and I have the pleasure of moderating today's session. Today, I will be learning on the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabeg, Wendat, Huron, and Haudenosaunee Indigenous peoples, land that now is home to many diverse First Nations, Inuit, and Métis people. As someone who works in environmental health, I am grateful for the environmental stewardship of Indigenous peoples who have protected, shared, and cared for these beautiful lands since time immemorial. Before we begin, a few housekeeping items. I'd like to start by disclosing that I have no conflicts of interest to declare. A discussion and question period will follow the presentation. We will make every effort to address as many questions as possible. It's now my pleasure to introduce our colleagues from the BC Centre for Disease Control to give today's presentation. Dr. Anne-Marie Nicol is a knowledge mobilization specialist who works to move information about radon from evidence into policy and practice. And Dr. David McVie is a public health physician specializing in environmental health. His work focuses on toxicology, poison control, environmental contaminants, radiation safety, extreme weather, and climate change. Quite a mouthful. With that, I'm going to pass things over to Anne-Marie to begin today's presentation.
Thank you very much, Elena. Can people see me? Okay. Thank you very much for that introduction, Elena. So I'd just like to begin by disclosing that our work is funded by provincial and federal governments. We have no commercial interest in the radon industry to declare, and we do not sell radon test kits, nor do we provide mitigation services. This presentation was created by its authors, and it will be published on the Public Health Ontario website. They're not the owner of the content, and applications or the use of the information is the responsibility of the user, and they assume no liability for our presentation or its contents. We have a number of learning objectives today, including understanding the epidemiology and the etiology of radon-induced lung cancer, discussing programs that can improve awareness and promote action, particularly for public health professionals, and understanding our BC Radon Data Repository on our map and how this can be translated into other jurisdictions. And we would like to also notice that we come from First Nations territories that stretch across every inch of our province. We are a province-wide organization, and we respect the inherent rights rooted in the connection to lands and waters that have never in our province been ceded or surrendered. Today, I am calling in from the traditional territories of the Coast Salish, Squamish, and Musqueam peoples in East Vancouver. I also like to start our presentation and reflect for just a moment about the idea that Canada is a uranium-rich country. This is a painting by one of the Group of 7 of a uranium mine in the Northwest Territories of Canada. And I also, at this point, like to acknowledge that Indigenous peoples have been part of our understanding of radon and its impact on communities, in part as they often worked within uranium mines. And it is actually the contribution of uranium miners that really has helped us understand the impact of radon on human health. So the contributions of Indigenous people through their workplace exposure also has had a profound impact on how we understand the etiology of radon today. So if you've come to this presentation with only a vague awareness about radon, or you just kind of heard the word, you are not alone. Statistics Canada does ask questions on the Household and Environment Survey that is provided every 2 years. This is the data up until 2021. So you can see a small and steady increase from 2013 to 2021 of people who can give a correct description of radon. And then on the right-hand side of this chart, you can see the problem. So while almost 50% of people now can actually address what radon is, very few people have still tested. So we really have an enormous knowledge to action gap here in the issue of radon, and this is really what drives my interest and continued work in this important portfolio. So radon is a radioactive element. It's an invisible, odorless, colorless, tasteless radioactive gas. In and of itself, it is a noble gas, and therefore it is inert, but it is part of the decay chain of uranium. And as such, as time goes on, radon decays. It only exists for about 3 to 4 days. And then as it decays, on the right-hand side or left-hand side here, you can see the uranium, radium, radon decay chain. It gives off alpha particle radiation, and I'll talk a little bit more about that in a minute. But Canada is a uranium-rich country. We have been, as I mentioned, mining uranium in this country for a very long time. Uranium is ubiquitous in the soils across the country, but some regions we know naturally have more, and that includes northern Saskatchewan, the Northwest Territories, parts of Ontario, and in the interior of British Columbia. And I'd just like to point out, especially if you're have interest in geology, radon is a really interesting issue because it's the only gas phase of the decay of uranium. So uranium remains as a metal bound in soils. It can be liberated in water, but it is when radon gas itself is generated that it becomes a problem because it can move. And it tends to move from denser, colder areas to warmer, more open spaces because that's basically what gases do. And as it decays, it generates alpha particle radiation, which people often say, oh, it's not a big deal because it doesn't go very far. And that is correct. It does not travel very far, but it actually has a high linear energy transfer, meaning that over a very short distance, it can pack a significant punch. And this is where the health impacts come along. And just a quick fun fact today, just know that one of the first people to even notice that uranium and thorium decayed into this gas phase was Ms. Harriet Brooks. She was one of Canada's first female physicists, and it was her very careful notes with Ernest Rutherford, in that group on the far right, that she actually was the first person in Canada and really arguably in the world to notice that radon gas actually was generated during radioactive decay. So radon is designated by IARC as a known human carcinogen, and that's in part because the evidence of lung cancer comes from occupational mining cohorts from Saskatchewan, Ontario, Newfoundland, and countries around the world. The WHO estimates that the risk of lung cancer increases about 16% for every 100 becquerels per meters cubed, and that's the unit that we use in Canada to measure radioactive decay in this way. Just to note that in the United States, they use the picocurie, which is a very different metric. And sometimes that can be confusing to the public, especially if they're listening to US media content about radon. But essentially, it's a linear carcinogen, and therefore, the higher the dose, the greater the risk. So in Canada, we actually have a very robust and active radon research portfolio. People are studying the carcinogenic mechanism, genomics, exposure biomarkers, looking at biological samples, including blood and toenails, nail clippings. And this is being done between the University of Calgary and Dalhousie. And in Ontario, recently the Northern Ontario School of Medicine received a large NSERC grant to continue studying radon gas. And we are actually one of the few places in the world where we really have this sort of active research and this sort of ongoing look for some of the ways that we can detect the impact of radon on the human body. And because radon, again, it has this high energy transfer that occurs, it can break double strands of the DNA. This is really where some of the concerns are around the development of tumors. It also generates reactive oxygen species and leads to hypomethylation. So there's a number of etiologic pathways that radon contributes to the development of cancer. Health Canada does sort of a back of the envelope attributable risk fraction, and they suggest that about 16% of all cancers in Canada, which is about 3,000 deaths per year, are due to radon gas exposure. Ontario is actually, you're the only province that has actually construed radon in this way, and I always find it incredibly helpful. So thank you to Public Health Ontario for creating this report in 2016. But of the things beyond tobacco that lead to the development of cancer, you can see that outside of solar radiation, radon in Ontario is estimated to contribute to 1,300 cases of cancer. In this case, it is very clearly lung cancer. So it is a significant contributor in terms of environmental exposures, and it far outstrips other environmental exposures, including things like arsenic and asbestos, which we know can lead to lung cancer as well. I often get asked about other carcinogenic outcomes related to radon exposure and other health effects. So I'm just going to quickly give you an update. Recently, there have been Canadian studies that looked at the relationship of radon exposure to both leukemia and lymphoma by Dr. Jing Chen. She's our leading radiation scientist in Canada, and they did find a positive exposure. This is ecological data, but in Canada, we're starting to have a lot more radon information, which provides more power to understand other cancers. This is important because, of course, the occupational cohort for which we first saw lung cancer develop was with working age men. So what are some of the other cancers that could be caused by radon gas outside of those populations? That research is ongoing. People have looked at gastric cancer through the ingestion of water that's contaminated with radon. It's soluble in water. That remains uncertain, that relationship. There is also the ongoing radon-exposed occupational cohorts where they've found other lung diseases and then cerebrovascular diseases that may be associated with radon. And the exposure assessment in these has been quite well done. And then interestingly, in the United States, in Texas, Connecticut, and Massachusetts, there are ongoing studies looking at exposure during pregnancy. These include both ecological and cohort studies. And they're looking both at fetal outcomes and maternal outcomes. And this is very new research. So how do people get exposed to radon gas? It's predominantly through indoor air. So again, radon is a soil gas, and it moves from cold, dense places up and out. So it can disperse into the outdoor air where it's safely diluted. The problem is when it enters buildings. So it enters buildings naturally through cracks and floors and sidewalls, sump pumps around drains and pipes. This is why levels tend to be higher in basement than in other levels of rooms, although we do see sometimes elevated levels in second floor bedrooms. And again, the only way that you can know if you have radon in your home is to test, because it is a colorless, odorless, tasteless gas. In 2007, Health Canada dropped the regulatory guideline from 800 to 200. So this says that people should be remediating homes at 200 becquerels or above. The occupational exposure limits have been 800, but they are moving to 200 becquerels as well across the country. And for public spaces, the 200 guideline is what is required. In 2009, after they dropped the guidance level, Health Canada did a large national cross-country survey. What they found was that there were no parts of Canada that were radon-free, although some regions had more homes with concentrations above the guideline level. At this stage, they estimated that about 7% of homes were above that level. But since then, there has been an update that was recently released this year, initiated by the University of Calgary, that amalgamates many different newer studies that have been done since that 2011 and 9 window. And this had a much more significant outcome. They're looking at about 17 to 18% of Canadians. They now estimate live in homes that are above 200. So that's more than a doubling of the number of people that are exposed since the 2009 to 2011's assessment. So why is this? There has been a number of hypotheses. These are still working hypotheses, but they could include the fact that these newer studies include different kinds of houses than the original study that was done, that we are now seeing in many cases poorer construction than historically, which means that foundations might be cracking. There's a real issue of aggregate shrinkage or concrete shrinkage that causes more gaps in the foundations of homes. We are building larger homes, which means that cracking of foundations can be more likely And we're going to talk a bit more about air tightness and energy efficiency because we are tightening up our homes and maybe inadvertently keeping gases in. So yeah, radon, the concentration of radon varies really by home, and there are many home-specific factors that dictate what levels could be. So air tightness, the age of the build of the home, the footprint, the renovations that have been done on the home, particularly for energy, and then the design. Vaulted ceilings have different air draws in other kinds of homes. And of course, the geology, the concentration of radon and uranium underneath the soils near homes, and then how a home is used, if people leave windows and doors open or if they keep their home pretty shut. So various factors influence radon levels. But what we've really learned over time is that the radon levels in Canada are actually increasing. And this is even though we've had building code changes to try and address radon, they haven't necessarily helped. So Dr. Jing Chen has also released a study looking at the age of home and the radon level. And you can see this incremental increase with an interesting bump in the 1970s. And this may be because many of those homes were actually energy retrofitted. And again, retrofits have been associated with higher radon levels. And this is similar to research that's being done in the United States. They also have found the same result, newer homes with higher levels. And just to say that the relationship between radon gas and energy efficiency, these are some articles from the 80s where concern was raised at that point in time that tightening up homes to conserve energy was likely to lead to increased radon gas levels. And unfortunately, the issue was not addressed at that time in Canada, but in the United States, they did start to make some changes. I recently did an update in 2022, published on the BC Lung website, and we did confirm that retrofits, particularly newer retrofits, can increase radon levels, particularly if homeowners add double or triple glazed windows and see more sealed doors, insulation, and then the sealing of cracks and sumps can actually lead to a doubling of radon levels. However, in Canada, we still have no requirements to test radon post-energy retrofit. So this is a project that we're working on with BC Lung Foundation to advocate for some of these greener home grants to ensure that they are addressing radon post-retrofit. So just to note that in Canada, we have a national radon certification program, and to let people know that if they need to have their house tested or mitigated, they can hire a professional. Now, it's an odorless, colorless, tasteless gas, and as a result, we need to be confident that the people who are measuring and fixing homes are certified and understand what they're doing. So in this case, you can go to the website. This is the Canadian National Radon Proficiency Program, which is supported by Health Canada. And they will, you can look up who's a mitigation professional in your region. Okay, I'm handing it over to Dr. McVeigh at this point in time. Are you there, David?
I am. Thank you so much, Anne-Marie, for that introduction to radon and an overview of its health effects. So Anne-Marie has talked about some of the factors that lead to radon in your home and can increase your exposure to radon. One of the ones that she mentioned, obviously, is geology, because radon does come from natural occurring uranium in soil and rock. So depending on the underlying geological features under your home, that can impact whether you're exposed to high or low levels of radon. And so this map here, produced by Radon Environmental, shows what we call radon potential. So the potential for a home to be exposed to radon due to the geology, features like uranium in the soil and other geological features. And you can see some general trends to it. I mean, obviously, if you look at the southern east portion of BC, you can see that those darker colors are more predominant in those areas, indicating a higher risk of radon. But if you look across the province, you see there's ribbons, there's threads, there's pockets. There's all sorts of variety about what level of radon you might be exposed to because of geology. And Anne-Marie mentioned also features about homes, particularly the age of home and air tightness, energy efficiency, things like that that can lead to radon gas accumulating and not easily moving in or out of the home. So you could have neighborhoods that even in an area that geologically might seem to have low levels of radon exposure because of the way the homes are built, might have higher levels than areas surrounding it. So for public health practitioners, trying to communicate with the public, trying to prioritize their time, their effort, their funds, it's difficult to know exactly what's going on, especially in a province like BC where you have kind of these big swings based on the geology. So one thing that we want to emphasize is you really can't tell ahead of time what your level of radon will be in a home. Testing is so important, as Anne-Marie said. So for some time, BCCDC has been working on this question about, where are homes most at risk of having high radon? And stretching back into around 2009, we have a report that actually Dr. Ray Copes, before he was at PHO, was at BCCDC and did some work about radon in homes. And we produced a map that you can see there that shows where the larger, darker circles are. There were higher levels of radon detected. But if you look at where the data was coming from there in that table off on the left-hand side, the second column there is the number of homes tested. And you can see that in some of those regions, it's a handful or a dozen, maybe a couple dozen homes. There really wasn't a lot of data to base any solid understanding of radon off of. But we did know that throughout the province, there was lots of other data that was available, data that was held by industry. So the certified testers that Anne-Marie mentioned, when they test homes, they tend to receive that data and keep it for their own purposes. Research groups, academics, other health agencies, all of these groups across BC had little bits and pieces of radon data. But it wasn't coming together into a coherent picture. And so we developed and put work into something called the BC Radon Data Repository. And I really do want to give credit to Anne-Marie and our other colleague, Jeff Trieu, who will kind of participate in the discussion, who did a lot of the legwork and the background work for this Radon Data Repository, even before I joined BCCDC. So you can see the success that we have had in bringing together data from across the province. And I'll talk more about what that looks like in a moment, but I just wanted to show you what the numbers look like. So if you look at the left-hand side of that graph, you can see the data that BCCDC held in the 90s from some residential testing that BCCDC had done on its own accord, some from other academics or other groups that had kind of shared it with BCCDC in an ad hoc way. And then beginning in late 2021 and 2022, when the BC Radon Data Repository kind of came into being, you can see the number of radon data holdings just increasing steadily over time, up to where we are now at 44,000 different radon measurements from across the province. And this is what it looks like, at a glance. We have 19 different pieces of the puzzle, 19 different external data providers that have shared their data with us. You can see a bit of who they are in that collage of logos off to the right there, but we're very grateful to them for sharing their data with us. Almost 45,000 unique measurements, as I mentioned. Not all of those are individual buildings, of course. Some of them are duplicates or different rooms in the same building. So we have about 25,000 different residential measurements, and we are able to geocode those or locate them to specific spots for 23,000 points. One of the key features of the BC Radon Data Repository that I'll describe a bit more in a moment is that we share our data with external parties in a appropriate way to make sure that it's being used appropriately. But for researchers or other public health practitioners who would like access to radon data, detailed high-resolution radon data, we have a protocol to share the data. And so we've received 6 external data requests for our radon data. And this sort of gives you at a glance some of the value of this collection and aggregation of data. So on the left-hand side, there is a map of BC at what we call the local health area resolution. So those are kind of administrative health areas shown across the province. And what we have shown is using cross-Canada survey data. So the data that Anne-Marie mentioned in her presentation where Canada, Health Canada had done a survey across the country of radon data. And it's color-coded to show which homes or what percentage of homes exceed Health Canada's level for what is considered to be the level at which you should act on radon in your home. And you can see that, we get some data, but there are big parts of the province where we're not seeing really much detail. And then you compare the data that we have in our BC Radon Data Repository on the right-hand side, and you can see there's far fewer gray areas. That's the first thing that you'll notice. But in particular, you'll notice that in some of those more sparsely populated areas where the Health Canada or a more sparse survey didn't pick up the detailed spatial resolution, you can see that those are areas that are at particularly high risk. Over 30% in some of those regions of the homes are above what Health Canada recommends as a level to act upon radon. So you can see the value of bringing together as much data as possible to be able to communicate well about radon. So what are some of the key features that have allowed us to work with industry partners, academics, all these other partners, and bring the data together and have our partners feel comfortable sharing the data with us? So first of all, it's all voluntary. And again, I want to give credit to Jeff for going out and putting a lot of legwork into meeting with partners, speaking at conferences, speaking at webinars, raising awareness of the Radon Data Repository, and making industry partners, academic partners feel good and comfortable about sharing the data with us. Everything is formalized with a data sharing agreement, and that lays out some key features, such as data providers continue to own their data. They can withdraw it if they choose to do so. We only use the data for research and health protection work. It's not used for any for-profit type of work. The external data request process is clearly laid out, and it goes through the same process through BCCDC that anybody else would go through to access BCCDC related health data. There's no person level data, only residences, and all of the data is anonymized so that it cannot be ever traced back to a specific home. And the degree of anonymization, the degree of jitter, depends on how dense the sampling is, so that it's we make sure that in a sparse area, the jitter, the anonymization is greater, so that there's no way that it can be traced back to the original home. For those of you who might be interested, I just want to note that the technical details have been published in the Canadian Journal of Public Health. I acknowledge that you can't read the details, obviously, of what's shown here, but I just wanted to acknowledge that the data comes to us in many different formats, and obviously it's messy when it's coming from different parties. So we have a very rigorous and careful algorithm to clean things, to align things, to geocode them to the appropriate level of spatial resolution, and as I mentioned, to anonymize it. And for those who are interested, feel free to visit Canadian Journal of Public Health and see those details. So one key feature of the BC Radon Data Repository is that the BCCDC ourselves has worked on is an interactive public map. When we released it in 2021, it was released as a desktop version, and it's been great. It's got good usage over the years. This year, we have optimized it for mobile use. So I think there is a link. You can look at it as we speak. There's a link that was just placed in the chat. But if you feel like it, please go ahead and access it through the QR code there also on your mobile device. It is Radon Action Month, and so we have a little bit of a promotion there to do a survey that's on the map, and you can enter your name for a $100 gift certificate if you're interested. I'll talk a bit more about it now. So you can see an image of it there on the left-hand side, what people are greeted with when they look at it on their desktop. People can easily select different metrics to see. They can see the median level of radon measurements in their region. They can see the percentage that are over the Health Canada recommended action level. There's a drop-down menu where they can easily change the level of geology the level of detail they're looking at, all the way from health authority, which is the big ones that you see there on the default, down to municipality. So people can go all the way down into their municipality if they want to see more detailed information, or if policymakers, politicians from different municipalities are looking at it, they can go and look at very detailed data that they have from their community. It's got a search bar so that people can search for their communities, and the same kind of zoom and pan features that everybody's familiar with from using maps online. And then when you click on one of those regions, an infographic pops up that you see on the right-hand side there that has some details about whatever region you're looking at. Here in the example, it's Kootenay Boundary, which is an area in the interior. And there's an infographic underneath that shows kind of the distribution of what 100 homes in that area might look like, and some context and details underneath about what different levels might represent in terms of risk of lung cancer. We found pretty consistent engagement with our with this public map over time. So this time series is showing daily page views back from when we launched it in November of 2021 up until basically now, December of 2024. And you can see spikes that are happening, obviously, when we have a push for Radon Action Month or for other conferences that we present at. But in the background, in between those spikes, we usually see about 50, 75 page views a day. So people are accessing it, looking at it, and interacting with it. And as we say up there, love to get another spike from this presentation, from these few things that we're doing today. So if you want to take a look, please do. So I mentioned earlier that one of the features of the Radon Data Repository is the external use. And just wanted to give some examples of that. So shown here are some different things that academic partners, public health practitioners have used it for. Across Canada survey of radon exposure in residential buildings. Down below that, you can see Université de Montréal thesis that was done using it about the density and proximity of oil and gas wells in northern BC to indoor air radon concentration. BC Lung has accessed the data quite a bit. They've produced reports that are targeted to communities saying you need to test more in your region because we don't have enough data. And other ongoing studies that are shown there too. So we're involved with one that is evaluating how different radon designs of a map impact users' risk comprehension, and another one that's investigating radon concentrations across different building types, which is a piece of data that we do hold when it's available in the repository. I wanted to focus down and talk about one use in particular. So historically, the BC building code divided the province into two regions. And you can see on that map there in the interior, kind of an area 1, where there was a radon rough-in was required, meaning that new homes that were built had to be ready to easily accept a radon mitigation system, which Anne-Marie will talk about more in a moment. And then in the coastal areas, called Area 2, it wasn't required. And BC Lung has been pushing for some time to say, no, there should be a unified approach to this across the province. Homes should be built to be ready to be mitigated for radon. And they produced a report and just wanted to highlight some of what they said. The bolding here is mine. I added it to emphasize the BC Radon Data Repository. But you can see that they made specific reference to it by saying that BCCDC has released a new radon map for the public based on data from the Radon Data Repository, saying the older 2018 list of communities is out of date in the sense that it's possible to see many communities on the map with a radon problem, but are not mentioned in the code. And this needs to be revised and include data from the Radon Data Repository and the map. And that is the recommendation that they made specifically, was that it be revised to use data from the updated BCCDC radon map. And ultimately, that is in fact what the BC government did. And you see this information bulletin describing some changes to the 2024 building code. And they say there that new data shows that radon exists in many areas of British Columbia, where it was not previously known to result in elevated radon indoor levels. And there is no longer reliable evidence to justify exempting certain areas from radon rough-in requirements. So a nice example of how the bringing together all those pieces of data allowed one of our partners, BC Lung, to take that, produce a report, advocate for changes, and that in fact did result in changes. And finally, before I hand it back to Anne-Marie, I just want to note that we are working with Health Canada on some preliminary planning for a national data repository to expand out the work that we've done in British Columbia across other provinces. So Anne-Marie has already engaged with many partners across the province. She's sort of leading portions of this work, but if you're interested in connecting and discussing, please get in touch with us. We're working on it right now. And with that, I will hand it back, I believe, to Anne-Marie.
Thank you, David. Okay, I'm going to talk just quickly about radon testing devices and a little bit more that public health should know. There's different ways of testing for radon. The devices in the front, the smaller ones, are the passive alpha track detectors. These are what we use for community testing. They are a single-use device. They are relatively inexpensive. The ones behind are now known as electronic radon detectors or monitors. They provide more consistent or ongoing testing. They are considered, though, less accurate than the devices in the front just because of the way that they measure. The one on the far left-hand side is one that we use for radon lending library programs across Canada. That's in part because it does not require a smart device to be read. It's very good for people all across the country, and it doesn't save data. People are often concerned that other people will know their private business or their readings, and so this can be reset and then taken back to the library. So one thing that I did want to point out to folks in public health is that ensuring that these electronic devices are accurate is important, particularly if you are going to be using them for research purposes or you have people who are asking you questions about them. The Canadian Radon Proficiency Program, the entity that certifies devices, they certify people, also certify devices. So there is an ongoing updated list of what devices that are considered more accurate. And on the right-hand side, we have seen Health Canada recall a number of radon detectors for actually essentially being spurious or incredibly inaccurate. So one thing you could do around Radon Action Month that's simple is help raise awareness about radon testing and then point people to the fact that to be careful when they're buying a detector, that those passive detectors, the cheaper ones, are really the most accurate, although they're not all that technologically gee whiz, but that actually the little ones are more accurate, and then to be careful what they're spending their money on. So what if your home is above the 200 becquerel guideline? Radon mitigation is actually incredibly effective. All homes can be fixed. And just to know that there is this idea that somehow we were using the building code to build the radon problem out, and that has really not been the case yet. As I said, the systems are getting better across the country, but people still have to test. And if they are above 200 or close to 200, we really recommend that people mitigate. A radon mitigation system really does. It was invented in Canada. It's also known as sub-slab depressurization. But in a nutshell, it drills a pipe that goes to underneath the house. It sucks up the radioactive gas, and then it vents it safely outside, so the gas never actually comes in the home. People do try to do things like balance their HRV systems to get radon levels down, but that means you actually have radiation in the home. This system actually sucks it up and vents it out without it ever entering the indoor environment. So if you're in public health and you want to know a bit more about how you can increase awareness and testing, or if you work for the federal government, the Health Canada does have a number of different initiatives, including the fact that they've created radon action guides for different jurisdictional levels. Health Canada also promotes Radon Action Month, which is November, and they have a postcard that they mail out to people all across Canada on a somewhat random basis. They started with the higher radon regions, but now they've got down to most Canadians at some point will have likely got this postcard in the mail, although maybe not this year due to the mail strike. So things that provincial governments can do is to do testing initiatives, do awareness programs, have things on your website to talk about radon action. We have seen, as David mentioned, there's contests and different things that people can enter. School and childcare testing also is important. In British Columbia, one of our health regions has embarked on a school testing and program. They also require childcare testing, and that is in that very high region in the interior of BC. And then Ontario Lung did do a workplace testing initiative, and the results of that are being published and will be available soon. And then municipally, there's lots of options for building officials. So if you know people in your community, there's lots of things that mayor and council and building officials can be doing to raise awareness. I just wanted to point out the fact that in Ontario, there has actually been quite a bit of radon testing over the years. So some places like KLFNA have done their own studies. So there's over 1,000 homes were done over the last few years. And then many of these other communities have participated in Take Action's 100 Test Kit Challenge. On the right-hand side, Kenora and these health regions, and then the township of Ashley, Colborne, and Wawoshna, sorry if I didn't pronounce that correctly, have started testing. So there's at least 100 people in each of those regions that are testing for radon. And then Algoma, Elliott Lake area will be testing starting in January of this year. And this is a free program where communities can apply to get 100 radon test kits, and then we work with municipalities to do radon awareness and then facilitate the test kit giveaway. Once those communities are finished, they get a report back, and many of these initiatives are in BC. They contribute to the contribution and creation of our Radon Data Repository and our map. So these are very useful because they often span the province, and that allows us to access data from places where we haven't seen testing before. And just to give you a sample of, I just randomly picked these results from some of those communities. So in North Kawartha, we had about 47% of homes above the 200 becquerel guideline. Woodstock was less, 15%. And then our nation's capital did do testing, and about 20% of homes in the Ottawa region were above the 200 becquerel guideline. So in summary, radon is a well-established known IARC1 human carcinogen. It causes lung cancer, but it may cause other health effects. And awareness and testing rates are still too low across the country. The problem being is that radon levels appear to be increasing. This could be because of building changes. Maybe we're building in new regions where there's more uranium in the soil as well. And then energy efficiency might be exacerbating the problem. Public health can get involved. There's lots of things that people can do. You can support community testing, simply promoting Radon Action Month and doing social media. You can test the public buildings that you're responsible for, and you can collate and share data and create things like the BC Radon Data Repository and Map. And then I believe we'll be sharing the publication that we used to guide the development of our map. And with that, I'm going to turn it over to Elena to field some questions at this point in time.
Okay, thank you so much, Anne-Marie and David, for a wonderful presentation today. As said, we're now going to move to Q&A, where our speakers will be joined by another colleague from BCCDC. Jeff True is an environmental health and knowledge translation scientist who provides analytic and knowledge translation support on projects related to environmental health and hazards, such as radon, poisonings, and substance use. Thank you for joining us, Jeff. For this session, we're going to ask folks to start entering your questions into the Q&A pod. And to get us started, Anne-Marie, I'm going to touch on a question that came in while David was speaking. And so this is, specifically around the new health evidence, the non-lung cancer health effects that have been researched. Wondering if you can comment on some of the references or some of the papers that have been published.
Sure, I actually anticipated that we would have epidemiologists online. So if we can go back to our presentation, thank you. I included some of these. So I think there's a slide before this one too. Okay. So yes, I have 3 slides and I will quickly go through the epi. So again, the cohorts of people that were exposed to radon, and there might be some people on the call who are part of these ongoing follow-up studies because, again, Canada has been such a major player in this area because we had so many people working in uranium mines and underground mines. So Dr. Richardson's research looking at the mortality found other lung diseases, sort of fibrotic diseases were associated, And then cerebrovascular outcomes is another one that they've seen in minors when they control for other factors. Radon seems to be statistically related to this. So I would point to these two publications. Where's the other one? Radon exposure during pregnancy. This one is particularly interesting. Again, there's a cohort study in Massachusetts, the study in Connecticut, and then the third one is an analysis that was done in Texas. It's important to remember that radon is soluble in blood, and this gives rise to this sort of more fulsome understanding of why radon might be an issue during pregnancy. The interesting thing about the maternal outcomes is they're associated actually with hypertension in the mother, and then there's birth outcomes in the fetus. So they're looking at it from two different angles. But then, yes, it's really important to recognize how this mechanism might occur, and I've just added some citations here around solubility. Oh, I didn't include the one from Jing Chen. Okay, and then just to point out too that there's a criticism in general, or a critique maybe of some of the other health effects studies, which is power, right? We really don't necessarily have large enough samples to be able to look at people exposed, and then the exposure classification has been problematic. But as we get more data in Canada, and that's part of what's going on in the United States, is that they actually have a lot more power now to do these studies because we have more radon data. And in British Columbia, now we have a significant amount of radon data, and we can start to look at data linkages and other health outcomes. So I think there's a lot more promise. And Dr. Shrista, I can send you the study by Dr. Jing Chen on lymphoma and leukemia that was published this year in 2024. It's an ecological Canadian study. Okay, I think we can stop sharing the slides at this moment in time. Thanks.
Thanks so much, Anne-Marie. That was great. Moving on to our next question. This one comes from one of our local public health authorities. At our public health unit, Leeds, we ran a radon testing blitz between 2019 and 2021. There was a decent response rate, which is always wonderful to see from homeowners. However, there were concerns within the health unit about reporting findings due to the possibility of perhaps legal issues arising. Things like home values at the neighborhood level, which I know we've talked about before. Did you run into these types of issues with your BC work?
I can give that. Oh, Jeff, you go ahead.
Okay, well, maybe you can give maybe like a broader answer, but I can speak to specifically our project. Yeah, for sure, that's something that we're cognizant about when we were initially developing the program. We looped in our privacy officers at the BCCDC and legal counsel as well that our organization has. To date, we've never received any sort of complaint of this nature when we began to reach out to data providers as well. We've never received any complaints when we reported summary statistics on our public map, or give presentations at webinars or conferences like this. And I think the main thing is that we do not, and we never report building specific measurements or anything that links to a particular individual. It's all ecological. And we always make the statements that, yeah, this is just regional summary statistics. There can be variation, and yeah, there is known variation within specific regions, as small as a particular neighborhood. One home can test high and its neighbor can test low, just given different building related factors that David and Marie mentioned earlier. And because of this, you can't really draw specific building specific conclusions from ecological estimates. So we just try to make that statement clear, because really that's the reality of this data. And I think that's just like another reason why individuals can't make a sort of that legal complaint. But yeah, it's definitely something we're aware of, but it's not a concern that we've heard directly ever in the past few years that we've managed this program and released these products. And Marie, do you have anything else to add on top of that?
Only that what we see, because the interior of BC, it's become quite well known. Again, that 30% of homes are above the level. And so it's actually become, rather than a disincentive for homeowners, especially if people are doing a real estate transaction, people are asking So they have, you know, we're going into this purchasing of homes are expensive in Kelowna. You know, have you tested for radon? And if they haven't, there is an escrow that happens in the real estate transaction. So people put money aside so that the new owner, if there hasn't been a test done, can test and then use that money to fix. So people who have tested and then remediated, it actually becomes a selling feature now that it's sort of a very widely understood to be a problem. So I think there's a shift from people being hesitant about it to this sort of more open, like, you know, this is a contaminant that I've dealt with. I recognize it's here and this is how, and you don't have to pay for it going forward in a new home.
Thanks, Jeff and Anne-Marie. I'll just also add that the question mentioned the neighborhood level data, and so we don't release, or our map doesn't show data at that level of resolution either. So that's part of it. Is, you know, the most zoomed in, the most resolved that you can get is the kind of the municipality level, and then if we are sharing data with an external partner, we would release data that is the least resolved necessary and that kind of matches the public health use that they're doing. We don't release line level data to any other partners.
Fantastic. Thank you all for those answers. Moving on to our next question. So for private tests conducted by individual homeowners, are these captured by the repository? And maybe if you could speak to kind of how they get into the repository.
Yeah, so the answer is that it depends. If you recall from the slide that David showed with all the logos, there are some private industry companies there, companies that manufacture test kits, that sell test kits. So if an individual bought one of their test kits, that would make our way back to our repository. If it's through another company that we don't have a data sharing agreement with, then it wouldn't. If that company, they sell test kits that gets bought by, say, the Take Action on Radon program, and they get distributed for a community program, we would get it through that way. So really, it just depends.
Okay, thank you. Next question, and we do have quite a few coming in. This is more from an individual community member perspective. I live in a region that has nuclear power plants and is accepting long-term repository for nuclear waste. Are there suggestions for how to promote, how to persuade public health to develop radon programs locally?
So I'll just make a comment about that, and Anne-Marie might want to comment on it also, who's done a lot of direct community level work. But one thing that brings up is that people are often concerned about external or unusual or artificial sources of radiation, such as, the nuclear power plant that is down the road, or the waste that is being brought into your home, or not your community, when in fact those sources are really generally well regulated and well monitored. And yet we're all exposed to this ubiquitous source of radiation every day in our homes that people tend not to be quite as aware of and quite worried about. So it may be an opportunity to say, look, if you're talking about radiation, if people in the community are thinking and are worried about radiation, yes, there is that nuclear waste, but there's also radon, which is a source of radiation that we can control, we are exposed to, we can test for it, and we can control it. So it may be an open door to talk about radiation and then kind of steer the conversation to radon in that way. Anne-Marie, I don't know if you have anything to add to that.
That was exactly what I was going to say. So yes.
Fantastic. The next question, have you seen a positive community response to the programs that give out the 100 test kits? And a follow-up question, this is an interesting one. How was the number 100 determined?
Sure. So I am, full disclosure, part of that program. It is in conjunction with the Canadian Cancer Society, the Radon Scientists and Technicians Association, and it's funded by Health Canada. So we get a lot of really positive community response. We test people together. We try to create a feeling of social connectedness. We give out introductory sessions where people meet each other. They learn who else is testing in their community. They learn about radon together. We make it easy for people they don't have to mail the test kits back. So people really enjoy it. Then we have a follow-up where we come back to the community, we talk about their results, we help connect people to mitigators. And in some cases, when levels are high, we even bring in people to train mitigators in communities, especially in rural and remote regions. This can be a challenge, finding somebody to actually fix people's homes. So it has been a very, it's a kind of a heartwarming program, to be very honest. And it was 100 tests for 100 days just because that was easy. So the tests have to be at least 91 days. And we just decided to make it catchy. And we have encouraged communities to challenge each other, and they have. So one community will do it, and then they challenge the community down the street. So it's been, it's very much a heartwarming program.
Thank you. Yeah, it's wonderful to see kind of the power of that catchy phrase, really engaging public audiences. The next question, what if someone tests their home and their level is above 200 becquerels per meter cubed, but they don't take remedial action? They don't do anything to address the issue, and then don't declare it when selling a home. Are you aware of any consequences after that real estate transaction?
There currently is litigation in this area, which I cannot speak to, but you must disclose if you know. Same with asbestos, urea formaldehyde foam, or if you have an oil tank in your yard. So not disclosing on the property has consequences. That is outside of my area of expertise. Dr. Noah Questel at the BC Lung Foundation is a practicing lawyer, and he's a very good person to ask this question to.
Thank you. An interesting question from one of our attendees. How did you get buy-in for industry partners to share data with you through the repository?
I can take this one. Really, we just try to emphasize that, we have no commercial interest in this radon measurement data. We're not trying to get it and resell it or anything like that. It's only research interest. It's only a public health promotion interest. We anonymize all the data. We're not trying to re-identify individuals and contact individuals. And we really just try to emphasize that there's really no risk to these industry folks. And really all our goal is to increase radon awareness in BC and Canada, which we don't say this, but, like indirectly, of course, that would support their work. Radon's this like interesting issue where there's stakeholders in the private industry. We don't do any mitigation services, but we want to reduce exposures in individuals' homes. So, we don't have any stake in that. That's all the private industry. So, they have to do what they have to do, and we have to do what we have to do in public health. And I think we're all on the same page with that. And, is try to just maintain positive relationships with people. I do acknowledge we're really close to being done the hour. So while I have the mic, can I just make a quick plug? So on our map, David shared it, that there's a QR code, there's a link. We also have a survey right now. We're soliciting feedback for the map. So please do check that out. We're just trying to get opinions on how things are laid out. If you know about radon and this is helpful for you, if you've used this data to support your work in any way, it's open there, and one lucky respondent will win a $100 gift card. So there's a little bit of incentive there. Okay, thanks. I just want to make that plug.
Of course. Happy to give you a moment to do that. And also I'm curious to see the kind of feedback you'll have from that survey. Given that we are just a few minutes from the hour, we are going to wrap up today's session. And so as we conclude, I want to extend my sincere gratitude to Anne-Marie, David, and Jeff for sharing their work with us today. As mentioned during the presentation, November is Radon Action Month. And one thing I just wanted to touch on, David did discuss the BC building code during his slides. And I want to note that there are key changes coming to the Ontario building code. They will come into effect January 1st, when radon gas protections will become a new building requirement for all regions, not just the 3 regions that to date have where it's been required in Ontario. With that, thank you to everyone for joining, and we hope you all have a wonderful day.